right. Thank you so much, Jason. We do have a question. Oh, I got to find it in the app, though. Okay. So from Lisa Van Hoos, is the bystander response data similar for race, ethnic, SGM, minority, hate, aggression? Are they most likely not going to respond?
Yeah, that's a good question. I've actually not seen it divided by like that. I would imagine, like anything, that sort of thing is culturally determined, and I'm sure that there are some cultures, and whether those match well to race or socioeconomic culture, I guess I don't know, where bystander intervention might be more common. Like, so if you're at a family event like Thanksgiving and a conflict happens between family members, bystanders are much more likely to intervene. When it's a question of strangers, it's much less likely. And I'm certainly willing to believe that it can vary based on culture. I just don't have that data in front of me. It's certainly an interesting question.
How about, well, from Amber, I imagine a lot of this would apply in domestic argument situation. Would you agree?
Oh yes. Oh yes. I mean, anytime you're in conflict with someone else, I think this can be a valuable thing.
Okay, I'm not seeing other questions out there. Do we have any more from the online participants, from the people in the room? Okay. So for Michael, sorry, I do not have my glasses on. Caller, I think. When, if ever, do you feel it's appropriate to intervene in someone else's conflict?
Yeah, that's a good question. I really think it depends on a lot of different things there. It also depends on the role you're playing in that environment. I have to say, just like, maybe it's just good to admit it, like, I'm an intervener. That's what I do, right? So if I'm at work, like, I'm at a position of authority where I work, so I'm kind of obligated to do that. But if I'm out in the world and there's some sort of conflict, like, I won't always step in if it's not safe to do so or if it doesn't seem necessary, but I have done that in the past. And it's something that you definitely should think carefully about. You should think carefully about whether you're prepared to do that, about what the safety considerations are there any legal considerations? And since if somebody gets hurt or is in conflict, since I have skills and training to help, I consider that part of kind of my responsibility to other people in that sense too. So I definitely will step in at times when I think my stepping in can be valuable, or if I think that it's safe to do so. And I think everybody's got to get that, got to work that out themselves. I mean, one of the things that you can always take comfort in is that, I mean, everybody's got this computer with them in their pocket that's got a camera on it. So if you see something bad about to happen in some sort of conflict between people, oftentimes when people are in conflict, watching bystanders video things, boy, that can be very valuable. Right. I can imagine that if I'm in a conflict with someone and things are speeding up and I'm trying to de-escalate and it's not working, if I saw somebody videotaping, man, that would be a great thing for me to say. I'd be saying, hey, look, there's a lot of people around. There's a lot of witnesses here. You know, she's filming this over there. Like, I don't want to fight, man. Like, this is like, we're on camera here. What can we do to resolve this? Right. Those are examples of how that can be a valuable thing to help with the de-escalation process.
Okay, and then we have a kind of a comment and a question from Aria. I think online. Aria, are you in the room? I don't think so. No? Yeah? No. Okay, I just heard a noise. Just kind of asking, I think, from the patient perspective, that, you know, some people can get violent, and that sucks. But to be blunt, do you really think someone suffering from chronic pain would be a physical threat?
Yeah, of course. You know, healthcare workers are injured by patients, and they're injured by their coworkers every day. I mean, the data on this from the Occupational Safety and Health Agency in the United States is very clear, right? Like, so I once took over the responsibility for a really big clinic, one of the biggest clinics in the Department of Defense, and I kind of got there. I'm just trying to get to know everybody. And I said, well, like, what are your concerns, and how can I be helpful here as a leader for you? And one of the things they said on the surveys is they were worried about workplace violence. And I thought to myself, oh my God, this is terrible. Like I can't believe people in my clinic are mistreating each other. And then I did some follow-on conversations, and it wasn't the coworkers with each other. It was patients and their families crossing boundaries and being physically violent with my staff, right? And we don't have to take sides. We don't have to pick the patient is right or the staff is right. We can, in this situation, acknowledge that there's a problem to be solved, and we can de-escalate it. And I had to take some very clear steps to teach my team behaviors and SOPs to follow in that case, because I had people pushed and hit and pinched and pushed backward over over therapy equipment from patients and families to them, even patients who had chronic pain and health problems. So yes, absolutely, I can think that. I think that way, and there's a lot of data that suggests that's a problem. And again, that doesn't mean we have to pick sides. We don't have to say people are good or people are bad. We can just say that when conflict like that happens, having skills to de-escalate it on all sides is very helpful.
All right. Thank you, Jason. And I think there aren't any other questions, but there is a vote for you to head over and help with Putin to de-escalate the situation. That's from Kara Bennett, or Barnett. Sorry, Kara.
Thanks, Kara. I'll see what I can do.
Okay. So we have, so that's it, I think, for you, Jason. Thank you so much for another great talk.
Thank you.